Hi everybody, it's Dr. Eric Balkavage, and we're back for Peripheral Neuropathy and Diabetes Learning Series. This is episode 11, and today we're talking about all cells don't respond to the same high blood sugar. So we got lots of cells in the body, and when we have high blood sugar, all the cells you would think are bathed by this high sugar, and they should all be damaged at the same rate. But we typically don't see that. We see things like liver cells and retinal cells, eye cells and kidney cells and nerve cells and blood vessel cells seem to get damaged more than other tissues. So why does this happen? Well, increased blood sugar typically causes increased insulin. So as the blood sugar goes up, as you eat, you increase glucose in your blood, increased blood sugar. The body responds to that by increasing insulin. Insulin helps get the sugar into the cells. When your cells, liver, or muscle tissue have gotten enough glucose that they need, they become insulin resistant. Then that sugar goes to get stored in fat cells, and so you get increased fat cell production. And then if you still have more, and then the fat cells become insulin resistant, and then if you continue to get more glucose into the cells, the body's got to find other ways to get rid of it. Make more fat cells, find other places to deposit that fat in around your belly and your organs to do something with it. So when cells have sufficient levels of glucose, the important part is they become insulin resistant. So they can't get more sugar into the cells. Some cells become insulin resistant as there's increased blood sugar. Some cells do not. Two cells that don't become insulin resistant as a response to high blood sugar levels are the vascular endothelial cells, the cells of your blood vessels, and your nerve cells. And so it's really important when we talk about neuropathy and diabetes is the two cells that we see the most damage with peripheral neuropathy is the blood vessels and causing cardiovascular disease, and nerve cells causing neuropathies, okay? So they should, in most cases, as blood sugar levels go up, the cells become resistant. But these two cells, their glucose transport isn't affected by the higher levels of blood sugar. So that means more sugar pours into the cells. So if it's a neuron or a blood vessel, as more sugar gets into the cells and that sugar can't be used appropriately, that sugar gets diverted to that polyol pathway we've talked about. And that polyol pathway increases alcohol production, and that alcohol production and the other polyols cause increased reactive oxygen species, increased inflammatory damage, increased advanced glycated end products, and it just causes damage and destruction to both the vasculature, where we see repair and we see this plaquing on the vessels and the arteries and narrowing of those and increased blood pressure. And at the nerve cell, we just see nerve damage, decreased nerve firing and signaling, slowed transmission, and we get neuropathy, okay? So that was episode 11. Not all cells react the same, so it's important that we reduce our sugar intake when we have neuropathy or we have diabetes. Even if you manage it with medications, you still have to reduce the carbohydrate load. Otherwise, the damage occurs even though your blood vessel levels or your blood sugar levels may look stable for a diabetic, or your hemoglobin A1C may look stable for a diabetic, the damage is still occurring.